in September, the world convened at the 73rd session of the United Nations General Assembly to commit to the ideals of achieving universal health coverage by 2030 through the high-level meeting on universal health coverage. At the time, no one could have predicted that barely 4 months later, the COVID-19 pandemic would literally bring the world to a standstill, shake our healthcare system at the very foundation, and demand the acceleration of healthcare reforms. Before this pandemic descended on our shores, we're building a road towards universal health coverage through our democratic process of deliberating the National Health Insurance Bill. In his State of the Nation address earlier this year, His Excellency President Cyril Ramaphosa reiterated the purpose of the NHI by stating that, and I quote, "It's a fundamental condition for growth and development is the healthy and productive population with access to quality and affordable health care," of quote. We continue to put great effort into improving health service delivery and prepare NHI to achieve universal health coverage. Honorable House Chairperson, COVID-19 has illustrated just how important data and information are in managing health decisions. We are pleased that during the past few months, the NHI information system capacity has been augmented, strengthened, and dramatically improved. Investments made in these improvements will all remain and enhance the capability of the department to manage the health system into the future. We've established a patient registry through the deployment of the health patient registration system in our primary health care facilities and hospitals. And to date, 51,909,554 patients have been registered. In addition, we have also developed a health systems dashboard, which will very soon go live. This system will support government with early warning signs in surveilling hospital infrastructure, alerting us to impending critical mass reach in various areas of our operations, and giving us an opportunity to respond before there is a crisis on the ground. One of the NTP's implementation goals is to build health infrastructure for effective service delivery. The department has developed a 10-year national health infrastructure plan to improve health facilities, to ensure construction of appropriate health facilities on a sustainable basis. Healthcare infrastructure will focus on the provision of new hospitals, community health centers, clinics, and maintenance and upgrading of established facilities that need to be expedited to improve citizens' access to more advanced healthcare facilities. The department has also prepared a proposal for resolving health infrastructure backlogs in preparation for NHI. This proposal will also play a significant role in job creation and stimulating economic growth and transformation of the construction sector. We believe that this health infrastructure program will improve public confidence in the public healthcare system, improve the morale of the personnel, and better staff retention because of a safer clinical environment. We have now started engaging key stakeholders, including the National Treasury and DBSA, to develop strategies to accelerate the program. Prior to COVID-19, consultations were already underway, even in the private sector, with potential investors and provinces. The health infrastructure commitment remains, and COVID-19 has taught us that the time waits for no man. If we are to achieve our infrastructure goals, we need to do so and with speed. Currently, a total of 20 hospitals and 34 primary healthcare facilities were revitalized, 7 primary healthcare facilities constructed, and 39 facilities refurbished. COVID-19 pandemic has also called for specific focus on the provision of additional ICU, high care space, isolation wards, and fever clinic with triage at existing hospitals. Provision of beds and emergency wards has also been prioritized either in existing facilities repurposed. Hospitals being prepared for the country for the surge in COVID-19 patients that will require hospitalization. Oxygen systems and equipment to support them have also been procured. Linen and warm furniture has also been upgraded. This improvement in infrastructure will remain as improvement to the capacity of the healthcare system post-COVID-19. House Chairperson, as the globe, we have tipped now over 15 million mark over the COVID-19 confirmed cases. As a country today, we report 13,104 new cases. This gives us a total of 408 and 52 cumulative cases. We have publicly stated that the storm is upon us. This is evidenced by the surge in different provinces, namely the Western Cape, Eastern Cape, Gauteng. KwaZulu-Natal appears to be following the same trend. The reopening of the economy, which led to the movement of the people in the country, has, with no doubt, contributed to the rise in numbers. However, we're mindful that the government had to grapple between protecting our citizens' lives and their livelihoods. It has not all proven to be easy exercise, with various sectors having their own expectations informed by challenges that they face. But we want to assure every South African that, inconvenient and uncomfortable as things may be, our intention is to do what is best in the interest of our people. The COVID-19 pandemic has indeed placed an unprecedented demand on the healthcare service delivery in our country. The recruitment of doctors, nurses, and other key professionals remain a priority during this period. We are pleased that between January to July 2020, a total of 2,547 medical interns, 8,624 community service personnel were also allocated to statutory posts. It is further expected that a total of 3,050 medical interns and 7,389 community service personnel will be allocated in 2021. In the previous year, the National Treasury allocated funds through the HR capacitation grants for a total of 9,165 posts for all health categories to be filled. These posts were filled as part of the process to lift the moratorium on filling vacancies and to alleviate shortfalls of health professionals in the health sector, despite financial constraints in government. And the following is a breakdown of the posts. Statutory and critical posts was 5,517 in 2015. Community service 3,002. It includes doctors and nurses and other health professionals. Number of permanent posts filled was 3,648, which is again in the same divided on those categories. We can never overemphasize that health workers are the backbone of our fight against this pandemic. It is therefore in our interest not only to recruit them, but to take sufficient measures to ensure that they are protected in the performance of their duties. From as early as March 2020, National Treasury made an allocation to provincial health departments for the procurement of the personal protective equipment. This was further augmented by the generous donations from various South Africans, corporates and society, also through the Solidarity Fund, and we have received donations from other governments across the world. For this, we are most grateful. It has indeed shown a true spirit of compatriotism. Honorable Chairperson, over the past couple of months, we've been hard at work on our 2020-2021 adjustment, scrutinizing every line item, reprioritizing for a rapidly changing environment. In this regard, the 2021-2021 annual performance plan that we tabled earlier has been adjusted to consider the likely impact of COVID-19 on the health system. We're also mindful that while we focus on this fight against COVID-19, we have a responsibility to ensure that gains made to our fight against HIV and TB and other programs are sustained regardless of the COVID-19 pandemic. It therefore gives me pleasure to table the new baseline budget of 2020-2021 based on adjustment at 58.4 billion rands, with a total allocation of 5.5 billion rand earmarked for COVID-19. The reprioritization focal area includes our most urgent and pressing needs in the midst of the surge of the COVID-19 cases. I would like to give an update on the research and related activities in the country. The COVID-19 pandemic has motivated all of South Africa's health institutions to rethink, reorganize, and reshape their priorities and agenda. In this context, many of the South Africa's leading research institutions and senior researchers have forged new national and global research collaborations aimed at answering critical clinical questions of public health interest. Surveillance studies for COVID-19 were established early in the lockdown to monitor the trends of COVID-19 infections amongst the healthcare workers and pregnant women. New surveillance studies are being planned to investigate trends in infection in households, communities, outbreaks, and in various workplaces, such as mining industry. Other studies in the development aim to evaluate improved diagnostic tests for the detection of recent and past infection. In parallel, SAPRA and the NHLS have developed a novel strategy to evaluate the quality of serology and molecular tests, both of which are critical for the country's management and understanding of the evolving outbreak. There are many clinical trials in the planning and in the progress that aim to identify the new technologies for the prevention of COVID-19 infection. These include vaccine studies, pre-exposure prophylaxis studies, and studies aimed at evaluating new therapies for both early treatment and for later treatment of hospitalized patients. Other studies underway include the establishment of pregnancy register to evaluate potential harm to pregnant women and their babies caused by COVID-19, and a number of qualitative studies exploring a socio-psychological impact of COVID-19 infection and the pandemic more generally in terms of social and mental well-being of South Africans. The health departments, entities, and statutory councils continue to play a vital role in supporting health services and improving the health of South Africans. The NICD received an additional grant of 96.7 million, and provinces were allocated 2.1 billion as rands as part of the 3.4 billion conditional grant to pay NHLS for expanded COVID-19 testing services. In response to COVID-19, the NICD has played an important role in including providing epidemiological support for provinces, developing and reviewing national guidelines, and expanding DEDCOV hospital surveillance system to monitor mortality and morbidity in all hospitals, and conducting new laboratory-based investigations including seroepidemiology, viral tracking, and viral culture. The Medical Research Council plays a role through research, innovation, development, and technology transfer, and the scope of the Medical Research Council includes research and laboratory investigations, clinical research, and public health studies. It also publishes a weekly report on deaths in South Africa. In the context of the COVID-19 pandemic, Medical Research Council conducted a study on the excess deaths during this period. Their findings revealed that there may be additional deaths which are unaccounted for on the basis of the modeling which they have done. Various possible explanations are given for this phenomenon, such as people dying from COVID-19 before they get to the health services, or people dying of COVID-19 but death not being reported as such, or people dying from non-COVID-19 conditions because of constraints in the health services. It has also been acknowledged that there is uncertainty about these excess deaths. However, in comparison with other countries, as of 18th July, South Africa recorded 1.4% of deaths, which is comparable to countries like India, which is 2.5, and Russia at 1.5, but significantly lower than the UK, which is at 15.4%, and Spain at 10.9%, and the US at 3.88%. We'll continue to analyze this trend, but it is not unique to South Africa. We have urged all provinces to report deaths as guided by the WHO protocols so that they can be recorded and reported so soon as information becomes available, to avoid a backlog such as what we have seen in the Eastern Cape. This tends to create a confusing and concerning perception that there's underreporting of COVID-19 deaths, and sometimes it gives us an impression that there was a huge upsurge in mortality, when in fact it is something that's taken place over several days. The South African Health Products Regulatory Authority continues to play a pivotal role in the licensing and regulating of medicines and medical devices. We are pleased that SAPRA has developed a detailed strategy to clear the inherited backlog, which is on track. We are aware that COVID-19 pandemic has caused SAPRA to prioritize applications relating to COVID-19, such as laboratory tests and sanitizers, ventilators, and clinical trials. The department recognizes that certain cannabis-containing products have also proven to be of medicinal indication. In addition to that, the development of cannabis industry has a potential to be beneficial to the country's economic growth, including empowerment of small farmers. SAPRA has also been involved in the development of the national framework for the growing and manufacturing and use of cannabis. We have recently also rescheduled cannabis-containing products, which now separates hemp, which is low THC-containing product, and with high levels of THC-containing products.